Do you know what happened to her?
I'm not sure. She was just complaining of epigastric pain about 10 minutes ago. She thought it was from sushi she ate last night, and the next thing I knew, she took a nosedive to the floor, collapsed near the desk.
Know anything about her medical history?
She told me she was recently diagnosed with deep vein thrombosis.
How'd she get that?
Apparently, she smacked her leg with a shovel, and she developed a blood clot. She's on Coumadin for the blood clot.
Is she on any other medication?
I'm not sure.
Any ideas, doctor?
I don't know. No.
Airway appears clear. No obstructions. I don't hear anything. Oral airway inserted, doctor. No gag reflex. What do you want for the flow rate? Oxygen administered. There's no pulse. Pulse present with chest compressions. Check the monitor. If anyone can save her, it's you, doctor. Doctor, what energy level should we use?
Charging. Everyone stand clear of the patient.
How many joules should be delivered?
Charging. Everyone stand clear.
And what energy level do you think is appropriate?
There's no pulse.
You're holding up well under the pressure. Normal saline administered, doctor. All right, it's removed. ET tube inserted.
You know your stuff.
Respiratory therapy, please report
I
before
think she said they were installing new sprinklers, and that's how she hit her leg.
It's a pleasure watching you work. Now, what medication do you want me to administer? You made the right decision. 1 minute she's complaining of heartburn, and the next, this. Medication circulated with chest compressions. Doctor, what energy level should we use? Doctor, what rhythm do you think that is? Exactly what I thought.
Dr.
There's no
Thompson,
pulse.
please
Pulse
dial
present
extension
with chest
7124.
compressions.
Dr. Thompson,
Nice work, doctor.
extension 7124.
What should I administer, doctor? Exactly what I
Dr.
thought.
Oppenheimer,
Flush
please report to
administered.
OR.
Keep doing what you're doing. What should I administer, doctor? The whole ward's on edge ever since it happened. Good call. Medication circulated with chest compressions. Now,
Surgery
what
intern,
medication
please
do you
report
want
to
me
the
to
operating room.
administer? Great choice, doctor. Looks like someone paid attention in med school. Medication circulated with chest compressions. Medication administered, doctor. Flush administered. Pulse present with chest compressions. What should I administer, doctor? Exactly what I thought. Flush administered. Medication circulated with
assistance
chest
needed on
compressions.
ASAP.
What should I administer, doctor? Exactly what I thought. I wish I knew more of her medical history. Good. Really good. What should I administer, doctor? Medication administered, doctor. Flush administered. Medication circulated with chest compressions. Now, what medication do you want me to administer? Medication administered, doctor. Flush administered. The patient's not responding. You did everything possible, doctor. Maybe we should consider termination of efforts.
Patients die, doctor. That's the reality of medicine. If you have a massive pulmonary embolism, chances are you're not going to make it. Rest assured you did everything you could. Your patient's massive pulmonary embolism was likely due to the deep vein thrombosis in her lower extremity. Well, I see we're in agreement about this patient's diagnosis. I'm impressed with how well you elicited the patient's history. This patient was in good hands with you. Your treatment was first-rate.
We got a call for an 82-year-old male. Wife says he's unable to make intelligible conversation. Residence is 978 Laurel Grove.
Got it. Hello there. How can we help you?
My husband's moaning woke me out of my sleep. I asked him if he was okay, but he can't talk.
What's his name, ma'am?
Robert Ashford. Everyone calls him Bobby.
Bobby, are you okay?
See?
Can you smile for me, Bobby?
Tell the nice man what's wrong, honey. Go ahead. Tell him.
Ma'am, has this ever happened before?
No, never.
When did you last see him acting normally?
About 10:30 last night. He was playing a little guitar before we went to bed. Don't worry. It's gonna be fine, honey. Just fine. He has high blood pressure and arthritis. No. We had dinner, a little before 7. No, never. No, he doesn't. No. He takes Captopril and Cilindac. Never. No. No, he hasn't. No. No. No, never. No. No, he would have told me. What could cause something like this?
Ma'am, I know this is difficult for you, but we need you to stay calm, please. All right, better get him in the ambulance. Man looks like he's caught in a bad dream and can't wake up. Deep breaths, Mr. Ashford. You're doing great. Let's take him to County General.
Doctor, what rhythm do you think that is? Exactly what I thought. Good call. Pulse is present. Looks normal to me. Nice work, Doctor. Nice assessment, Doctor. What should I administer, Doctor? Medication administered, Doctor. You know, sometimes you make it look easy. This patient's lucky to have you, Doctor. Lungs clear.
Look, I'm talking again. I'm sure my wife's like having me quiet for a change. They tell me I'm gonna recover 100%. Thanks.
When a blood vessel supplying the brain is occluded, an ischemic stroke can occur. But of course, you already knew that. I see you documented the appropriate diagnosis. Nice work. I'm impressed with how well you elicited the patient's history. This patient was in good hands with you. Your treatment was first-rate.